Hello.
Hello,
Um, so, what is your name?
Tim O'Brien,
What is your primary language?
English,
What is your age and date of birth?
27, 10, 22, 93,
Where were you born?
Plymouth, Mass,
What is your gender preferred?
male,
And what is your race?
white,
And what is your marital status?
single,
What is your ethnic or cultural origin?
Irish,
What is your highest level of completed education?
bachelor's degree,
And what is your occupation?
marine engineer,
And is your health insurance commercial, state, or federal?
commercial.
And do you know where you are?
Do I know what?
Do you know where you are?
Right now?
Yes.
Yes,
Where are you?
Madison, Maine.
Good. And do you know what the date is?
I have to look. July 19th.
Perfect. Do you know who the president is?
I do.
Can you tell me who?
Joe Biden,
And can you tell me your name and date of birth one more time?
Timothy O'Brien, 10, 22, 93.
What is your chief complaint, your reason for seeking health care today?
I have a headache.
Okay. When did your headache start?
This morning around 9 p.m. 9 a.m., sorry.
Okay. What brings your headache on or makes it worse? Anything make it better or worse?
Doesn't seem to.
No, doesn't. What brought it on, do you know?
I woke up with it.
Could you describe it? Is it like a pulsating headache? Is it a throbbing headache?
It was just
Sharp.
like a constant pain, headache. Sharp, I guess.
In the front of your head like that?
Yeah.
Does it radiate anywhere? Does it go anywhere other than just here? Does it? No.
No, it doesn't seem to.
What would you say your pain is on a 0 to 10 scale? 0 being no pain and 10 being the worst pain of your entire life.
Probably a 3.
So it started this morning. Has it been constant? Has it changed?
Pretty constant, maybe a little more so when I stand up.
Has this ever happened before?
Not for this long.
What do you think it means? What do you think you're getting a headache?
What do I think is causing it?
Mm.
I don't know if it's dehydration. I've been trying to drink a lot of water, but
Do you drink a lot of coffee?
yeah.
Have you had any past medical history?
No,
Any hospitalizations? Anything like that?
just for a broken wrist.
Which wrist?
My right one?
Did you have any childhood illnesses? Measles, mumps, rubella, chickenpox, strep throat?
No,
Any surgical history?
just wisdom teeth taken out, that's all.
Are your immunizations up to date?
Yeah.
Any psychiatric history, mental health problems? Any allergies?
No.
No environmental allergies?
Nope.
Are you taking any medications at this time?
No.
Prescription, over the counter, any herbal remedies?
Nope.
When was your last exam? Would you happen to know?
2 years ago.
Has your mother had any health conditions? Any history of health conditions?
Like high blood pressure runs on that side of the family, or both sides actually.
And is she living or deceased?
Living.
Does your father have any health conditions?
I think he doesn't have any health conditions, but high blood pressure runs in his side of the family.
On that
also.
side. And is he living or deceased?
He's living.
And then your mother's grandmother, your mother's mother, your grandmother, on your mother's side, any health conditions that you know of?
Heart attacks. That's all I know of.
And is she living or deceased?
Deceased.
And for your father's mother, did she have any health conditions?
She had Alzheimer's.
And is she living or deceased?
Deceased.
And then your grandfather on your mother's side, did he have any health conditions?
I think just high blood pressure.
And is he living or deceased?
Deceased.
And then on your father's side, his father, any health conditions?
He had a heart attack and he is deceased.
You are not married. Do you have any children?
No.
So I'm going to ask you some more questions. Are you an immigrant?
No.
Do you have any spiritual resources or religions that you prefer?
No.
How would you perceive your own health?
Fair?
Have you had any appetite changes lately?
No.
Are you satisfied with your current weight?
Yeah.
Have you had any recent losses or gains of weight?
No.
Recall of any unusual intake? Are you eating normally?
Yeah, I'm eating normally.
Do you have any cultural restrictions or intolerances?
Nope.
And do you know about how much you drink a day?
I don't keep track.
Like a gallon, maybe?
Probably a gallon.
A gallon of what?
Water.
Have you had any, so I'm going to ask you a couple more questions. Your bowel, have you had any issues with emptying your bowels?
No.
No. You're going normally?
Yeah.
How often do you go?
Once or twice a day.
And then your bladder, are you having any trouble urinating, any burning,
No.
incontinence?
Nope.
No. And where do you live?
Madison, Maine.
And is that an urban, rural community?
Rural.
Are you in a home or a house, trailer,
House.
camper? House. Do you any known exposures to any environmental toxins?
No, I don't think so.
In your occupational health, do you have any known exposure to any environmental toxins at work?
Benzene.
Benzene. Are you able to perform your activities of daily living at home?
Yeah.
Yeah. Do you need any help getting dressed, bathing, anything like that, moving? No. How are family decisions made in your household?
Mutually, I guess.
And do you live alone? Do you have a partner?
I live with my partner.
And then impact of family members' health on the family. Would that be a big impact if somebody were to get sick?
Yeah.
Do you have any trouble with memory, speech, judgment, any of your senses, taste,
Nope.
smell, hearing,
No.
feeling? Numbers. Do you sleep well at night?
Yeah.
Do you know about how many hours of sleep you get a night?
Close to 8, probably 7 to 8 a day, a night.
Do you take naps?
On occasion.
How many pillows do you use?
1.
And any sleeping aids to help you sleep? Anything?
Just a fan.
Do you exercise regularly?
I get exercise just from doing stuff around the house.
And do you do that often? About how often a week? How many times a week?
Pretty much every day.
So, do you have any hobbies?
Yeah.
What do you like to do?
I like to go four-wheeling. I like to ride my motorcycle.
Do you wear a helmet while you're on your motorcycle?
No.
Have you traveled outside of the United States recently?
Yes.
Where?
Mexico.
For what?
For work.
Do you smoke cigarettes?
No.
Any alcohol use?
On occasion.
And any substance use, including marijuana?
No.
Are you at home? Do you feel safe?
Yeah.
Yeah, no one hits you, beats you?
Nope.
No. Have you had any major life changes in the past 2 years?
Yeah, probably. I moved just over a couple years ago.
Do you feel tense about that?
No.
No. Do you have any sources that help you with your stress?
I don't don't see myself particularly stressed out.
Are you sexually active?
Yeah.
Do you have a gender preference?
That I'm interested in?
Yes.
Female?
Has anything changed about your sexual health or function recently?
No.
So have you had any weight changes recently? Any weakness?
No.
Any fatigue?
Nope.
Any fevers?
No.
Any new rashes, lumps, sores, itching, dryness, or color change of your skin?
Nope.
Any change in your nails or hair?
No.
And you've had the headache
Yes.
since this morning.
Mhm.
Any head injury associated with that?
No.
No. Any dizziness?
No.
No. Vertigo? Where you feel like the room's spinning around you and you're just kind of standing there? No. Any nausea, vomiting, diarrhea?
No.
Have you had any vision changes?
No.
No. Any eye pain?
Nope.
Do you wear any corrective lenses?
I do.
Contacts?
Contacts, yeah.
When was your last eye exam?
10 months ago.
Any excessive tearing?
No.
Any double vision, blurred vision?
Nope.
Any change in hearing?
No.
No. Any ringing in your ears?
Nope.
No. Any earaches, infections, discharge, hearing loss? Do you use hearing aids?
No.
Have you recently had any colds, congestion?
No.
Any nasal obstruction? Any discharge, itching, hay fever, allergies? Any nosebleeds, change in sense of smell or sinus pain?
No.
Any bleeding gums, mouth pain, toothaches?
No.
Any lesions in the mouth or tongue?
Nope.
Do you use dentures?
No.
When was your last dental exam?
Last month?
You had a sore tongue, dry mouth, sore throat, hoarseness?
No.
Have you ever had a tonsillectomy?
Nope.
And any altered taste?
No.
In your neck, any new lumps, enlarged or tender nodes, swollen glands?
No.
Do you have a goiter around your thyroid?
I don't know what that means.
You'd have like a lump right here, not your Adam's apple.
No.
Any pain, neck stiffness, or limitation of movement?
Nope.
No. Any lumps, pain, discomfort, nipple discharge, rash, or surgeries to do with your breast?
Nope.
Do you do self-exams?
Yeah.
How often?
I mean, like, I see my body in the shower and I shower daily.
Any lump, swelling, or rash of the axilla?
No.
Have you had a cough, productive or non-productive?
No.
No. Any coughing up any blood?
Nope.
Anything like that? Any shortness of breath, wheezing? Any pain, like chest pains? Or, no. Okay. Any history of lung disease for you?
No.
No. Any toxin or pollution exposure? Do you know have you ever had a chest x-ray before?
think so.
No. And have you ever had a TB skin test?
That I don't know.
You might need one to get into college.
Probably had one then.
Maybe not. I don't know. Okay, so any chest pain or discomfort at this time?
No.
Any recent chest pain or discomfort?
No.
Any palpitations?
No.
Any dyspnea or shortness of breath?
No.
Any edema in your legs, or your legs swollen, or anywhere else seems swollen?
No.
Any, have you noticed any cyanosis or your fingers turning blue or
No.
anything like that? Your lips? No. Are you urinating at night? Like, do you awake often at night
No.
to urinate? Do you have a history of heart murmurs?
No.
No. Any hypertension, anemia, or coronary artery disease?
No.
Any appetite changes recently?
No.
Have you noticed any jaundice in your skin or your eyes where they look yellow?
No.
No. You denied nausea and vomiting. Any dysphagia where you have a hard time swallowing?
No.
Any heartburn, pain?
No.
No. Any belching, flatulence?
No.
Is that just normal?
Normal, yeah.
Any change in bowel habits?
No.
Any blood in your stool? No. And any hemorrhoids, constipation, diarrhea, or food intolerance?
No.
And then with urinating, are you having any frequency?
No, seems normal.
Seems normal. Any urgency?
No.
No. Any blood in your urine?
No.
Okay. Any hesitancy, dribbling?
Nope.
Any hernias?
No.
Are you regularly having sexual intercourse?
Yeah.
Are you seeming interested in sexual intercourse?
Yeah.
And everything seems to be going normal? You're not having any erectile dysfunction
No.
with that? No. Are you feeling satisfied?
Yeah.
Are you having any discharge or sores on the penis?
No.
No. Any exposure to HIV?
No.
Any testicular pain or masses?
No.
And do you ever do a testicular exam on yourself?
Yeah.
How often?
I don't know, on occasion, I guess. Not sure how often.
Any coldness, tingling, or numbness in your extremities?
No.
Any leg cramps?
Nope.
Varicose veins?
No.
History of blood clots?
No.
No. Any discoloration of hands?
No.
And any ulcers anywhere? Are you having any muscle or joint pain or cramps?
No.
Any joint stiffness?
No.
Do you have a history of arthritis or gout?
No.
No. Are you having any limited movement or history of disease in your back?
No.
Any syncope, seizures, weakness, or paralysis?
No.
Any history of stroke?
No.
No. Any numbness or tingling
Nope.
anywhere? Any tremors, tics?
No.
Involuntary movement? And coordination problems? Memory or mood change? History of mental disorders or hallucinations? Have you ever had anemia? No. Do you bruise easily or bleed easily?
No.
Have you ever had a blood transfusion?
No.
Any lymph node swelling?
No.
And any exposure to any toxic agents or radiation?
No.
Any heat or cold intolerance?
No.
Excessive sweating?
No.
What is your shoe size?
11.
11. History of diabetes?
Do you mean
For you.
family? No,
For
not for
you.
me.
For you, no. Any thyroid disease?
No.
And do you use hormone replacement?
No.
And do you have any abnormal hair distribution? Any anxiety, depression?
No.
And denied memory changes? Have you ever had a suicide attempt?
No.
And any complaints of any mental illnesses today?
No.
Okay. It was nice working with you.
Thanks.